Hi, my name is Adam Schetzlar with Sound Balance Physical Therapy, and today I would like to talk about which is better, heat or ice? I get asked this question probably on a daily basis when I'm treating patients, and the hot pack, the cold pack, they don't really care. One's not necessarily better than the other. It depends on you. It depends on what your ailment is. So let's talk about heat first. Hot packs are great for relieving pain, improving blood flow, circulation. Typically we're going to use a hot pack for a chronic issue, so something that you've had a long time, something that's not new, arthritis, things like that. Ice, on the other hand, is typically for more of an acute injury or something that just happened. You sprained your ankle, you hurt your wrist, you were out in the yard too long, new injuries. Generally, I recommend you use ice anytime you're not sure between one or the other, because one of the things causing your pain is that inflammation cycle that your body goes through, and your body is actively swelling. Your body's trying to increase blood flow to the area and generally just brings too much. So you get that swelling, you get that pain, and if we go ahead and throw a hot pack on top of that, you're going to increase that even more. You're going to have even more swelling, you're going to have even more pain. A typical question I get with the hot pack is, well, it makes me feel better, so I'm going to go ahead and put that on there. And then an hour later, it's worse, and worse than it was before they put the hot pack on. And so what that is you get that initial warmth and heat, and it feels good, and it's bringing blood flow to the area, and it generally feels great. An hour later, your body has processed all that, you've swollen, and now you're in more pain because all that swelling in there, you can't really move as much. That pressure has increased in the joint and in the spaces, and you just can't move. So we're going to do heat for a acute or heat for a chronic injury, something that you've had for a long time that your body's not generally going to be actively swelling, and ice for a new injury, especially for the first 2 weeks. So here is your 2-week education. You want to pay the price after you get an injury. So you're going to protect the injury, try not to hurt it again. You're going to rest so your body can heal. You're going to use ice or cold packs to decrease that swelling. You are going to compress, so if you have a wrap or something that you can put on there to give it a little bit of compression, and then you're going to elevate and try to get it above the level of your heart, again, so that we're not overdoing all of that swelling. So, which is better, heat or ice? Depends on you and your specific injury. When in doubt, try the ice first, because it's not likely to flare anything up, whereas the heat could flare things up and make it worse. The ice might not make it better, but it's typically not going to make it worse. I know a lot of you out there are not going to be thrilled with that because we usually like the heat more, but try the ice when in doubt, and for a chronic injury you can go ahead and move on to the heat. Thank you and good luck.